Ghaith Prometric Questions and Answers, Part 5.
Ghaith General Knowledge. Brachial artery to check pulse in infant. Prolactin hormone promote milk production. TB tests, Mantox or PPD tests result within 48 to 72 hours. The accurate test is sputum culture. Umbilical cord, 1 big vein and 2 small arteries. Pulse deficit is the difference between apical beats and brachial pulse. Religion that prohibits blood transfusion is Jehovah. Spina bifida position, prone position. Sound lung in heart failure, crackles. Position after hemorrhoidectomy, anterolateral position. The left anterolateral position is an excellent alternative for hemorrhoidectomy under local anesthesia. The pain over the pubis and the low backache, frequently encountered in the prone position, are totally eliminated. Exposure of the operative fields is excellent. Post-vitrectomy position, prone. Eardrops in infant, down and back. In adult, up and back. Hyperpyrexia is above 40 degrees Celsius. Alzheimer's deficiency, serotonin. Abdominal assessment, inspection, auscultation, percussion, palpation is very important. During newborn assessment, the nurse found extra finger in the newborn hand, polydactylity. During newborn assessment, the nurse found 2 digits are fused together, syndactyly. When we should stop magnesium sulfate? If there is respiratory depression, hypotension, bradycardia, deep tendon reflex. Antidote of magnesium sulfate, calcium gluconate. Morphine antidote, naloxone. Hydrocephalus signs, bulging anterior fontanelle and increased head circumference. Naloxone. Digoxin should not be given if heart rate less than 60 or bradycardia. OPV, oral polio vaccine, mix of live attenuated poliovirus. Postpartum perineal assessment acronym is RIDA, redness, edema, ecchymosis, discharge, approximation. When taking a BP, select the appropriate cuff size. A cuff that is too small will yield a false high reading, and a cuff that is too large will yield a falsely low one. Complications of diabetic mother, hypoglycemia, and macrosomia. OPV vaccine is live attenuated virus. Patient with BP of 230 over 180 is considered hypertensive crisis. A mother brought her 6-month-old healthy infant to a well baby clinic. Which immunization should the nurse anticipate to administer as per HWO recommendation? A. Varicella. B. Rotavirus and hepatitis. C. Measles, mumps, and rubella. D. Diphtheria, tetanus, and pertussis. The answer is D. Diphtheria, tetanus, and pertussis. The nurse is teaching a 32-year-old pregnant woman how to distinguish between pre-labor, false contraction, and true labor contraction. Which statement about pre-labor contractions is accurate? A. They are regular and increasingly gradually. B. They are felt in the abdomen. C. They start at the back and radiate to the abdomen. D. They become more intense during walking. The answer is B. They are felt in the abdomen. A 3-year-old child is admitted to the hospital with seizures. He was alert, oriented, and has a rash in his extremities and is diagnosed with meningitis. While doing physical examination of him, he starts to develop seizures. The blood pressure is 100 over 57, heart rate is 110, respiratory is 30, the temperature is 39.5. Which of the following vaccine is used to prevent meningitis? A. HIV vaccine or Haemophilus influenza vaccine. B. Varicella vaccine. C. BCG vaccine. D. Rubella vaccine. The answer is HIV vaccine or Haemophilus influenza vaccine. HIV vaccines are highly effective in preventing HIV disease, including meningitis or inflammations of swelling of the lining of the brain and spinal cord. After receiving multiple mosquito bites and experiencing flu-like symptoms, a patient consults a nurse at a clinic and asks whether an appointment to see a healthcare provider is necessary. Which of the following statements should be the basis for the nurse response? A. Antiviral medication can be prescribed to destroy virus. B. Clinical signs can be mild flu-like symptoms to fatal encephalitis. C. If patient has West Nile virus, symptoms will progressively worsen. D. If patient used insect repellent, virus would have been destroyed when mosquito made skin contact. The answer is B. Clinical signs can be mild flu symptoms to fatal encephalitis. A male client has received a prescription for Orlistat for weight and nutrition management. In addition to the medication, client states plan to take a multivitamin. What teaching should a nurse provide? A. Be sure to take the multivitamins and the medication at lesser 2 hours apart. B. As a nutritional supplement, Orlistat contains all the recommended daily vitamins and minerals. C. Multivitamins are contraindicated during treatment with weight control medications such as Orlistat. D. Following a well-balanced diet is a much healthier approach to good nutrition than depending on a multivitamins. The answer is A. Be sure to take the multivitamins and the medication at least 2 hours apart. Which of the following variables is considered as a major factor that affects community health? A. Personal behavioral choices include socio-cultural factors. B. Number of healthcare providers in hospital within the community. C. Quality of the public safety officer includes police officers and firefighters. D. The number of recreational services in the community. The answer is A. Personal behavioral choices include socio-cultural factors. During meningitis outbreak in one of the hospital, the non-immune staff were given an immunoglobulin in order to prevent them from the infection. What is the type of immunity that will be developed by this staff? A. Active. B. Long-term. C. Natural. D. Passive. The answer is D. Passive. The surgical unit nursing staff were instructed to follow the hospital protocol by reporting cases of any patient's illnesses that are developed during their hospitalization, especially the post-surgical wound infections. Why must the nurse implement this protocol? A. Control unnecessary hospitalization. B. Assess hospital infection rate. C. Report nosocomial infection. D. Improve reporting system. The answer is C. Report nosocomial infection. Which of the following statements indicates that a nursing staff need an education session related to confidentiality and information security? A. Giving the password to patient's family member. B. Leaving the computer in the nursing station secured. D. Leaving your personal electronic password safe. D. Allowing nursing students to read medical record to their patients. The answer is A. Giving the password to patient's family member. Which of the following is the best action to effectively increase surgery capacity? A. Adapt outpatient departments for inpatient. B. Bring the injured people into the green zone. C. Provide care for the injured people with the available staff. D. Use the available supplies as it is difficult to arrange for additional. The answer is A. Adapt outpatient department for inpatient. A patient has been experiencing recurrence of otitis media on antibiotic therapy and the patient was scheduled for preparative teaching. The patient asked the nurse about the purpose of the procedure. What is the best answer for the nurse should provide? A. Stimulates motion of the ossicles. B. Detects permanent hearing loss. C. Allows drainage of purulent fluid from the middle ear. D. Enable medication administration directly to the affected ear. The answer is C. Allows drainage of purulent fluid from the middle ear. After assessing patient's medical records, which behavior nurse shows the patient's confidentiality has been breached? A. Reviews patient's medical record. B. Read patient's care plan. C. Disclosing patient's information. D. Documents medication as administered. The answer is C. Disclosing patient's information. The nurse manager prepares unit clinical operational plan. What is the top priority in this plan? A. Infection control. B. Staff orientation. C. Quality projects. D. Safe patient care. The answer is D. Safe patient care. The nurse is caring for a child with a diagnosis of pneumonia. The plan of care includes nebulizer treatments and chest physiotherapy. When should the nurse perform chest physiotherapy? A. Prior to the nebulizer treatment. B. After the nebulizer treatment. C. Intermittently during the nebulizer treatment. D. Continuously during the nebulizer treatment. The answer is B. After the nebulizer treatment. While taking the history from a new patient, the nurse identified that he had hypomaniac episodes, which was alternating with a major depressive episodes for the last 2 years. What is the most likely diagnosis? A. Bipolar 1 disorder. B. Bipolar 2 disorder. C. Dysthymic disorder. C. Cyclothymic disorder. The answer is D. Cyclothymic disorder. A 65-year-old woman visited the gynecological outpatient with history reveals that she had 3 pregnancies, 1 abortion, gestational age, had 2 normal deliveries. She smokes 20 sticks. Her complaint is that she wets herself when she coughs, embarrassing for her. Which of the following can be considered as risk factors pelvic floor muscles? A. Chronic coughing. B. Diabetes mellitus. C. Excessive spot. D. Sedentary lifestyle. The answer is A. Chronic coughing. A nurse is assigned to care for a Muslim female emergency cesarean section. The patient asked to wear a headscarf during the surgery. Which of the following is the most appropriate? A. Ask the patient to remove the scarf. B. Tell the patient that it is okay to wear the scarf. C. Ask the patient to wear a surgical cap. D. Tell the patient that a request will be during the surgery. The answer is C. Ask the patient to wear a surgical cap. A 62-year-old male patient in the cardiac surgery ward is admitted for the coronary artery bypass surgery. He has unstable angina for the past 1 year and is apprehensive about the open heart surgery. What essential assessment needs immediate attention? A. Fear and anxiety regarding procedure. B. Need for spirometer and breathing exercise. The answer is B. Need for spirometer and breathing exercise. A patient was on regular doses of lithium carbonate. The nurse noticed that he has hand tremor, polyuria, diarrhea, and vomiting. What immediate action should be taken by the nurse? A. Diuretics. B. Withholding lithium. C. Calling the psychiatrist. D. Monitoring serum lithium level. The answer is B. Withholding lithium. Which of the following condition is contraindication for a woman oral contraceptives? A. Dysmenorrhea. B. Menorrhagia. C. Thrombophlebitis. D. Toxic shock syndrome. The answer is C. Thrombophlebitis. A 55-year-old man takes cyclosporin by mouth twice per day. He had a heart transplant 2 months ago. He complains of stomach cramping, diarrhea, and muscle twitching. Which electrolyte is most likely elevated? A. Calcium. B. Sodium. C. Magnesium. D. Potassium. The answer is D. Potassium. The doctor is about to perform a aseptic procedure, and the doctor touched the bed of the patient by the sterile gloves, and the nurse should A. Ask him to change the gloves and to give him new one. B. Let him to complete the central line procedure. The answer is A. Ask him to change the gloves and to give him a new one. Mr. Ahmad admitted to ICU with congestive heart disease. His vital signs is BP is 110/60, heart rate is 120. The stroke volume is 80. The nurse expected cardiac output to be is A. 180. B. 1,700, C. 2,400, D. 9,600. The answer is D. 9,600. The formula of getting the cardiac output is stroke volume multiplies to heart rate. So the stroke volume is 80 multiplied to heart rate is 120. So the result cardiac output is 9,600. General knowledge. A mother came with her baby with thalassemia. The nurse will monitor iron level and chelation therapy with deferasirox or deferoxime to prevent organ damage. A woman is 5 weeks gestation diagnosed with hyperemesis gravidarum. What is the most important nursing action? A. Psychological support. B. Folic acid supplement. C. Strict intake and output record. D. Providing the woman with a high-protein diet. The answer is C. Strict intake and output record. A nurse is preparing to administer 25 mg of iron dextran inject to patient with iron deficiency anemia. The nurse knows this to be given subcutaneously and wants to administer the drug safely. Which of the best administration techniques? A. Z-track. B. Deep IM. C. Use of large gauge of needle. D. Insert needle at 45 angle. The answer is A. Z-track technique. A surgical nurse is assigned to care for a woman who had undergone vaginal hysterectomy. The nurse performed assessment. Which of the following potential problems that the nurse should observe? A. Pain. B. Fever. C. Anxiety. D. Bladder dysfunction. The answer is D. Bladder dysfunction. A 45-year-old man who is hospitalized feels the constant need to keep things in order, particularly with eating, and the nurse observed him arranging the food on his plate into symmetrical and equal bite-sized pieces. He constantly worries that the food served could be outdated and potentially causes illness. Which nursing diagnosis is most important? A. Ineffective verbal communication. B. Self-esteem disturbance. C. Impaired social interaction. D. Anxiety. The answer is D. Anxiety. A 50-year-old male was diagnosed with subdural hematoma, underwent burr hole craniotomy for subdural hematoma 3 days ago. In order to detect the sign of meningitis as one of which of the following indicates the patient has meningitis? A. Negative Kernig sign. B. Positive Brudzinski sign. C. Absence of nuchal rigidity. D. Glasgow Coma Scale of 14 points. The answer is B. Positive Brudzinski sign. A 10-year-old boy diagnosed with appendicitis has severe pain. The tool of pain scale to be used is face pain rating. B. Flack rating scale. The answer is A. Face pain rating. A 78-year-old alert and oriented patient is returning from the radiology department, and the nurse is preparing to transfer the patient from the wheelchair back into the bed. The nurse places the belt on the patient and prepares to lift the patient from the chair. Which body mechanics would be the most appropriate? A. Widen leg stance. B. Bend over to lift. C. Rotate from the waist. D. Maintain base of gravity in the feet. The answer is A. Widen leg stance. A 70-year-old male patient is brought to the emergency department on wheelchair. He complained of drowsiness, fatigue, lack of appetite for the last 3 days. With history taking, the patient stated that he did not eliminate since 5 days, and he is not ambulating because he has arthritis in both knees. Why constipation is one of the most common problems of immobilized patients? A. Decreased peristalsis. B. Increased colon motility. C. An increased defecation reflex. D. Decreased tightening of the anal sphincter. The answer is A. Decreased peristalsis. A patient is admitted to surgical unit after a removal of foreign body from the trachea through the bronchoscopy. He is exhausted and is monitored for stability. What is the most desired outcome of nursing care? A. Presence of cough reflex and expectorant. B. Relaxed, pain-free, and easily in breathing. C. Optimum oxygen saturation at room air. D. Increased energy and activity level. The answer is B. Relaxed, pain-free, and easily breathing. A patient has undergone pericardiocentesis as part of the management of cardiac tamponade. Which of the following would be most indicative of cardiac tamponade recurring? A. Facial flushing. B. Declining heart sounds. C. Muffled heart sounds. D. Increasing blood pressure. The answer is C. Muffled heart sounds. The classical physical findings in cardiac tamponade include in Beck's triad are hypotension, jugular venous distension, and muffled heart sounds. A nurse is caring for a pregnant patient who is diagnosed with abruptio placenta. Which of the following findings of assessment would indicate a concealed hemorrhage? A. Maternal tachycardia. B. Decrease in fundal height. C. Rigid board-like abdomen. D. Acceleration in fetal heart rate. The answer is C. Rigid board-like abdomen. The symptoms of placental abruptio may include vaginal bleeding, pain in the belly or board-like pain in the belly, back pain, labor pains, uterine contractions that don't relax, blood in the bag of water or amniotic fluid, feeling faint and not feeling the baby move as much as before. In placenta previa marginalia, the placenta is found at the A. Internal cervical os partly covering the opening. B. External cervical os slightly covering the opening. C. Lower segment of the uterus with the edge near the internal cervical opening. D. Lower portion of the uterus completely covering the cervix. The answer is C. Lower segment of the uterus with the edges near the internal cervical os. Marginal placenta previa. The placenta is positioned at the edge of your cervix. It is touching your cervix but not covering it. A community health nurse visited a postnatal primigravida mother who went back to work. The nurse instructed the woman the different position of breastfeeding in order to lessen the burden of the mother at night. Which of the following position will the nurse recommend for the mother at night? A. Cradle hold. B. Football hold. C. Reclining position. D. Side-lying position. The answer is D. Side-lying position. A 7-week-old infant boy is admitted with projectile vomiting, decreased urine output, decreased bowel movements, and weight loss. He has poor turgor and appears hungry. The nurse observes left to right peristaltic waves after he vomits. The nurse would expect to find which of the following during the physical assessment? A. Hepatosplenomegaly. B. A palpable pyloric mass. C. Lymphadenopathy. D. Bulging fontanelles. The answer is B. A palpable pyloric mass. A woman in 5 weeks gestation diagnosed with hyperemesis gravidarum. What is the most important nursing action? A. Psychological support. B. Folic acid supplementation. C. Strict intake and output record. D. Providing the woman with high protein diet. The answer is C. Strict intake and output record. Before administering a dose of furosemide Lasix to a 2-year-old with a congenital heart defect, the nurse should confirm the child's identity by checking the hospital ID band and A. Verifying the child's room number. B. Verifying the identity with the second nurse. C. Asking the parent the child's name. D. Asking the child to tell you his name. The answer is C. Asking the parent the child's name. A patient is diagnosed with obsessive-compulsive disorder or OCD, continually carries a toothbrush, and will brush and floss up to 50 times each day. The healthcare provider understands that the patient's behavior is an attempt to accomplish which of the following? A. Experience pleasure. B. Relieve anxiety. C. Avoid social interaction. D. Promote oral health. The answer is B. Relieve anxiety. Before sending a client for a CT with contrast dye, what is the nurse's most important action? A. Teach about the need for post-procedure hydration. B. Verify that the informed consent is complete. C. Place the side rails of the bed up before transport. D. Check the client's health record for allergies. The answer is D. Check the client's health record for allergies. A head nurse of a coronary care unit delegated the staff a senior nurse in the unit. What initial step must the head nurse implement before? A. Check the hospital policies for delegating tasks. B. Explain the task to the senior nurse. C. Negotiate with the senior nurse. D. Take the signature of the senior nurse. The answer is A. Check the hospital policies for delegating tasks. The nurse is about to perform venipuncture to initiate intravenous therapy with 0.9% normal saline solution. Before venipuncture, the nurse collects the required supplies and plans to perform certain action. Which of the following action is the most important? A. Apply a tourniquet below the site of venipuncture. B. Place an arm board at the joint above the venipuncture. C. Apply cold compress over the vein to be used for venipuncture. D. Inspect 0.9% normal saline solution, the date of expiry. The answer is D. Inspect 0.9% normal saline solution, date of expiry. A patient is being weaned off from the mechanical ventilator is about to hook the endotracheal tube to oxygen of FiO2 of 40. Which of the following oxygen administration device is the best the nurse in this situation? A. Ambu bag. B. Venturi mask. C. Tracheostomy collar. D. T-piece or Briggs. The answer is D. T-piece or Briggs. A patient is transferred to the post-anesthesia care unit or PACU after surgery with epidural anesthesia. After taking the patient's vital signs, what should the nurse assess next? A. Spinal headache. B. Post-operative pain. C. Bladder distension. D. Ability to move legs. The answer is C. Bladder distension. A nurse received the serum digoxin level result for the patient and notes that the result is 2.6 ng per ml. The test is digoxin, the result is 2.6 and the normal value is 0.8 to 2 ng per ml. Which of the following is the nursing action is the most appropriate? A. Notify the physician. B. Check previous vital signs of the patient. C. Record normal value on nursing notes. D. Administer scheduled dose of medication. The answer is A. Notify the physician. The therapeutic levels of digoxins are 0.8 to 2.0 ng per ml. The toxic level is greater than 2.4 ng per ml. What is the best treatment of digoxin toxicity? Digoxin immune Fab or Digivab is the mainstay of treatment for life-threatening digoxin toxicity. A client who is Gravida 1 Para 0 is admitted in labor. Her cervix is 100% effaced and she is dilated to 3 cm. Her fetus is at positive 1 station. The nurse is aware that the fetus head is A. Not yet engaged. B. Entering the pelvic inlet. C. Below the ischial spines. D. Visible at the vaginal opening. The answer is C. Below the ischial spine. A 30-year-old woman has no menstruation for 5 months and her menstrual cycle is 28 days. She controlled her diet and do heavy exercises. This woman's condition is A. Pregnancy. B. Primary amenorrhea. C. Secondary amenorrhea. The answer is C. Secondary amenorrhea. Secondary amenorrhea occurs when a patient who has passed menarche goes 6 months or longer without menses. while some sources only require 3 months without menses to diagnose amenorrhea. A nurse was newly appointed to work in the surgical ward. She was assigned to take care of an obese patient who just had an open laparotomy. Her mentor told her to pay attention to the surgical risks associated with obesity. Which of the following post-operative complication the nurse should consider at higher risk complication? A. Hunger. B. Gas pain. C. Hemorrhage. D. Impaired wound healing. The answer is D. Impaired wound healing. A 45-year-old woman patient was diagnosed with bronchial asthma and was admitted in the medical ward. The nurse told the patient to metered dose nebulizer. Which of the following action indicates that she understands the instruction? A. Inhale slowly and deeply puff. B. Does not shake the pre-packaged nebulizer. C. Administer the puff rapidly between breath. D. Remove the aero chamber immediately after administering the puff. The answer is A. Inhale slowly and deeply puff. Which of the following is the first step for inhaler technique education in patients with asthma? A. Breath out gently. B. Place mouthpiece between lips. C. Shake the inhaler. D. Wait a few seconds, then repeat the above process. The answer is C. Shake the inhaler. A nurse is caring for a child with diagnosis of pneumonia. The plan of care includes nebulizer treatment and chest physiotherapy. When should the nurse perform chest physiotherapy? A. Prior to the nebulizer treatment. B. After the nebulizer treatment. C. Intermittently during the nebulizer treatment. D. Continuously during the nebulizer treatment. The answer is B. After the nebulizer treatment. General knowledge. When assessing the fundus level at 36 weeks, it is the Scfhs process. Pregnant women with genital herpes, cesarean section. Caput succedaneum refers to swelling or edema. Nephrotic syndrome, urine color is dark urine. Nephritis syndrome, the color is bright urine. Stages of grief after death, the 5 stages: denial, anger, bargaining, depression, and acceptance. Complications of MI, dysrhythmias. Nursing supervisor have shortage of staff, call for help. Gestational diabetic mother can be treated with diet management. Basal skull fracture signs, raccoon eyes. Signs of intracranial pressure in infant with hydrocephalus, bulging anterior fontanelle. General knowledge. Complication of MI, dysrhythmias, heart failure, pulmonary edema, angina, pericarditis, Dressler syndrome. The causes of MI: atherosclerosis, coronary artery disease, elevated cholesterol level, hypertension, smoking, obesity, and stress. Watery rice diarrhea. The disease is cholera. A nurse evaluated dietary practices of a patient who had been as having acute glomerulonephritis. The patient verbalized following the appropriate diet for acute glomerulonephritis. Which of the following diet verbalized by the patient is approved diagnosis? A. Restricted fluid intake. B. Restricted dietary protein. C. Increased intake of low-fiber food. D. Increased intake of sodium-rich food. The answer is A. Restricted fluid intake. Which of the following is best describes the role of a case management? A. Promotes healthy lifestyle. B. Provides coordination of care to ensure continuity. C. Possesses highly skilled communication methods. D. Promotes the comfort of the patient. The answer is B. Provides coordination of care to ensure continuity. A 3-year-old child is admitted to the hospital with seizures. He oriented and has a rash in her extremities and is diagnosed of meningitis. While doing physical examination of him, he started to do seizures. The blood pressure is 100/57 and the heart rate is 110. Which of the following is the priority of care during the seizure? A. Put the child on right side. B. Protect the child from injury. C. Call the physician immediately. D. Administer oxygen 100%. The answer is B. Protect the child from injury. A 5-year-old child admitted with bacterial meningitis and is having seizure. Which of the following intervention the nurse should initiate? A. Restrain the child's limbs to prevent injury. B. Slowly put the child on his side on the floor. C. Clear the area of objects and administer oxygen. D. Roll the child to prone position to protect the airway. The answer is B. Slowly put the child on his side on the floor. A female patient is diagnosed with cancer. She intended to spend a part of her money for the poor people in case of her cure. This action by the patient is considered A. Denial, B. Acceptance, C. Bargaining, D. Anger. The answer is C. Bargaining. A 70-year-old woman is admitted to the cardiac care unit with atrial fibrillation and is receiving intravenous diltiazem and heparin. What is the most likely nursing diagnosis? A. High risk for infection. B. High risk for impaired gas exchange. C. High risk for decreased cardiac output. D. High risk for disturbed sensory perception. The answer is C. High risk for decreased cardiac output. A patient is hospitalized with chest pain is diagnosed with angina pectoris. Which of the following discharge instruction takes priority? A. Recognize signs and symptoms that require immediate report. B. Maintain low cholesterol, low sodium, and low potassium. C. Carry heavy objects away from the chest area. D. Maintain physical exercise daily. The answer is A. Recognize signs and symptoms that requires immediate report. The nurse is assigned to care for a patient with Paget's disease, complaining of bone pain. Which of the following condition is the patient high risk for? A. Hypomagnesemia. B. Hypernatremia. C. Hypercalcemia. D. Hyperkalemia. The answer is C. Hypercalcemia. When several bones have active Paget's disease, the increase in bone breakdown can lead to an elevated blood calcium level. This is rare, but it can cause symptoms such as fatigue, weakness, abdominal pain, constipation, and loss of appetite. Paget's disease of bone is a chronic, long-lasting disorder that causes bones to grow larger and become weaker than normal. The disease usually affects just one or a few bones. A 25-year-old primi gravida visited her primary health care with the husband. He says that his wife delivered 5 days ago. For the past days, she is very irritable and crying for nothing. She is tired and sleep, and he is very concerned about her condition. Which of the following diagnoses by the attending physician will be her symptoms? A. Postpartum blues. B. Postpartum psychosis. C. Postpartum depression. D. Postpartum anxiety. The answer is A. Postpartum blues. Differentiation of postpartum blues, postpartum depression, and postpartum psychosis. For the postpartum blues affects 50% to 75% of mothers. Symptoms last up to 2 weeks postpartum. The symptoms include mood swings, anxiety, sadness, irritability, feeling overwhelmed, crying, reduced concentration, appetite problems, and trouble sleeping. For postpartum depression affects 1 in 10 women. The symptoms can begin immediately and last up to a year postpartum. The symptoms are depressed moods, severe mood swings, excessive crying, insomnia or sleeping difficulty, reduced interest in activities once enjoyed, severe anxiety, intense irritability and anger, difficulty bonding with a baby, feelings of guilt or inadequacy, thoughts of harming yourself or the baby. For postpartum psychosis, affects 0.1% to 0.2% of mothers. The symptoms begin in the first 3 months postpartum. The symptoms are depressed mood, confusion, disorientation, hallucinations, delusions, sleep disturbances, obsessive thoughts about your baby, paranoia, attempts to harm yourself or the baby. A 44-year-old woman presented to the emergency department with eye pain and redness. She was diagnosed with uveitis related to viral infection. The doctor prescribed dexamethasone eye drops. Where is the correct place to instill eye drops? A. Above the eyelid. B. Directly into the cornea. C. Into the conjunctiva sac. D. Outside the conjunctiva sac. The answer is C. Into the conjunctiva sac. A 22-year-old man presents to the emergency department complaints of breathing difficulties. He appears restless and reports that he has a cough with thick green sputum for days. The nurse performs auscultations over the lung fields. The blood pressure is 130/80, heart rate of 100, respiratory of 28, temperature of 39. Which clinical findings is most likely heard over the right lower? A. Decreased vocal resonance. B. Decreased fremitus. C. Tympani. D. Bronchial. The answer is D. Bronchial. A hospitalized 72-year-old man who uses a walker is receive medication and must use the bathroom several times each night. To promote the safety of the patient, which of the following appropriate nursing action? A. Keep the side rails up. B. Leave the bathroom light on. C. Provide a bedside commode. D. Withhold the patient's diuretic medication. The answer is C. Provide a bedside commode. A man patient admitted to the medical unit was diagnosed with deep vein thrombosis and complaining of pain on both legs. Which of the following nursing diagnoses most likely describes the problem? A. Risk for injury. B. Fluid volume exists. C. Electrolyte imbalance. D. Impaired tissue perfusion. The answer is D. Impaired tissue perfusion. A client is admitted in the emergency room due to mild metabolic acidosis associated with dehydration and potassium. The doctor administered Hartmann's or lactated ringer intravenous fluid and electrolytes replacement. Which of the following elements of the lactated ringer solution is the highest value? A. Calcium. B. Sodium. C. Potassium. D. Magnesium. The answer is B. Sodium. A client with a blunt trauma underwent an exploratory laparotomy repair, an intra-abdominal injury, a nasogastric tube attached on suction, and 2 closed wound hemovac abdominal drains. He is receiving an intravenous infusion of lactated ringer with epidural continuous morphine. 24-hour post-operatively, he develops hypotension, tachycardia, oliguria, and severe nausea. Which of the following is the priority nursing diagnosis? A. Nausea. B. Rest for infection. C. Deficient fluid volume. D. Impaired urinary elimination. The answer is C. Deficient fluid volume. A client in the second stage of labor is unable to push and lacks to bear down. What is the most appropriate next step? A. Assess fetal descent. B. Infuse intravenous fluid. C. Empty the client's bladder. D. Administer oxygen to the mother. The answer is A. Assess fetal descent. A discharge planner is reviewing the file of a patient in preparation to move him from the acute care to home care. Which activities should the discharge planner to do ensure the continuity of care? A. Make referral to the appropriate department. B. Visit patient's house to make sure it is safe. C. Call pharmacy to prepare medication for the patient. D. Organize transportation for patient to be moved to. The answer is A. Make referral to the appropriate department. A newly assigned nurse to the home health care department was conducting a pre-entry phase of home visit. Which of the following activities would the nurse do? A. Call physician for referral order. B. Collect information and schedule the visit. C. Establish mutually acceptable goals for care. D. Conduct a health history and physical assessment. The answer is B. collect information, and schedule a visit. A nurse was educating a group of women on prevention of infection. The nurse asked each woman to state one preventive vaginal infection. Which woman needs more education? A. First woman said, keep vaginal area clean and dry. Second woman said, wear cotton underwear. C. Third woman, wipe from front to back after urination. D. Fourth woman, do vaginal douche twice a day. The answer is D. Fourth woman said, do vaginal douche twice a day. A 15-year-old girl is admitted after a motor vehicular accident. The child has a fracture in her left leg and a wound in her face. When dealing with this child, the nurse should be aware that important tasks to achieve during this age is which of the following? A. Initiative versus guilt. B. Industry versus inferiority. C. Trust versus mistrust. D. Identity versus role confusion. The answer is D. Identity versus role confusion. Identity versus role confusion is the fifth of 8 stages of psychosocial development that take place between the ages of 12 and 19. During this stage, adolescents need to develop a sense of self and personal identity. While initiative versus guilt is the third stage in Erikson's 8-stage theory of social-emotional development. This stage, also referred to as the preschool stage, can include many children in the age of range of 3 to 6. Inferiority is the fourth stage in the model. Generally, children enter this stage at the age of 6 to 12. The stage of trust versus mistrust is the first stage of Erikson theory and also the first period after birth. It occurs from birth to 18 months. A 66-year-old woman presents to the emergency department triage unit with labored breathing. She appeared anxious and is sweating profusely across the forehead. The symptoms had begun suddenly 1 hour before. The jugular veins appear distended and she has a productive cough. On auscultation, the respiration is wet and now clear when coughing. The blood pressure is 148/88 mmHg. The heart rate is 94. The respiratory is 26. The temperature is 37. Which triad acuity rating is most appropriate? A. Urgent. B. Emergent. C. Non-urgent. D. Resuscitation. The answer is B. Emergent. For Canadian Triage and Acuity Scale, the level 1 is resuscitation, conditions that are considered threats to life or limb requiring immediate aggressive intervention. Level 2 is emergent, conditions that are potentially threat to life, limb, or function requiring rapid medical intervention. Level 3 is urgent, conditions that could potentially progress to a serious problem requiring emergency interventions. Level 4, less urgent, conditions that relate to a potential for deterioration that would benefit from intervention. Level 5, non-urgent, conditions that may be acute but non-urgent and interventions can be safely delayed. A nurse is providing a health teaching to a client about the proper use of cane during ambulation. The nurse could include which of the following instructions about the correct use of cane? A. Patient moves the stronger legs forward to the cane. B. Patient holds the cane on the strong side of the body. C. Patient leans on the cane to provide support to the weaker side. D. Patients move the cane forward about 4 inches to the strong side. The answer is B. Patient holds the cane on the strong side of the body. A child with jaundice and treat with phototherapy. How can you protect the child's skin? A. Avoid oily substance. B. Use Vaseline after skin cleaning. C. Applying cream. The answer is A. Avoid oily substance.